Afternoon, everyone. So this is your information about CMEs and CEUs. If you have any questions, please just chat Rana and she'll help you with that. You'll also get a copy of these slides afterwards, so you can refer to them later. I have nothing to disclose in relation to the content of this presentation. Today I'm going to talk about ACT for chronic pain. This is a psychosocial or psychotherapeutic intervention called acceptance and commitment therapy. It is considered one of the stronger evidence-based therapies for individuals with chronic pain. It has also been very successfully used for a whole host of other mood disorders, for substance use disorders specifically, with really good results. And it also has some new data coming out for individuals with things like PTSD or other more severe issues. So what I'd like to introduce today, since some people are familiar with this treatment and other people aren't, is to really just give a global overview of some of the foundational aspects of acceptance and commitment therapy, so that you have an idea of what this treatment is intended to provide, some of the theory that's behind it, address specifically how ACT works with chronic pain, and then go through the main components that a therapist would go through if they were using an ACT model to treat a chronic pain patient, with some example exercises. So that way you really have an idea of what this treatment would look like. And then to wrap it all up, I want to provide some resources to look at additional ACT reference literature or manuals that are widely available, as well as additional trainings. I know not all of you are therapists or are interested in getting additional training in ACT, but if this is something that you would be referring patients to, I think this would be helpful information, hopefully to really generally know what this treatment is and how it's used. Okay, so to start with, I'm going to talk about what is ACT? So this comes from some of the developers when it was developed in the 90s, Hayes, Wilson, and Stroessel, and they say acceptance and commitment therapy, or ACT, is a therapeutic approach that uses acceptance and mindfulness processes and commitment and behavior change processes to produce greater psychological flexibility. And I'm going to break this down into those components, because I know that that's a mouthful. So where did it come from? Well, it's considered a third wave behavioral therapy, which means that it really stems from traditional cognitive behavioral therapy. But the third wave component is the addition of mindfulness. So individuals might be familiar with dialectical behavior therapy, or DBT, which is also considered a third wave. It comes from the foundation of CBT, but it adds some extra components to it. It is empirically based, which means they've done numerous, into the thousands at this point, gold standard clinical trials using ACT manuals or ACT protocols for a range of conditions. And looking at, they've even done dismantling studies to look at, which are the components that are responsible for some of the change that we see with this therapy, looking at the acceptance pieces, the mindfulness pieces, the commitment to change pieces, and all of them seem to be necessary aspects at increasing psychological flexibility. Within the ACT model is the primary mechanism of action. So to help people become more flexible in their thinking is what ACT is really geared to do. It's a different approach from traditional CBT, which would help people to change the content of their experience. And what that means is changing, if I change my thinking or my behavior, then I'm going to change the experience. ACT places priority on helping individuals change how they relate to their experiences. So it doesn't have direct cognitive challenging or behavioral interventions associated with it the way traditional CBT does, but it really is set up to help people experience their life differently by helping them focus on some of those things in kind of a backdoor away from CBT. So where does it come from? Its foundation is this thing called relational frame theory, which for those of you that might not be familiar, this is one of the theories that is under a lot of our exposure treatments. So in treating things like specific phobias, various like panic disorder, PTSD, we use exposure techniques, which is about helping people to approach what they're afraid of rather than avoid it. And those are all stem from this relational frame theory. This is also the underpinning for ACT. And what it's saying is that human beings can and will basically relate anything to anything, and they will make a number of false or what are called erroneous connections that create a lot of the automatic thinking, which then causes the emotional pain or suffering. And so the idea in this theory is that whatever we say to ourselves, whatever we're thinking, whether it's internally or we're actually verbalizing it, our mind believes it literally. And we can break that down in session for people so they can see how false that is. But unfortunately, this is our default. This is the default in how our brain operates. So when we say, I can't fill in the blank, or I can't stand it, I won't be able to, you know, any number of those kinds of statements, we literally believe that to be true. And so therefore we create our own reality vis-a-vis our thoughts. And so that means that if we could control our thinking, we can make our life much more pleasant or much more unpleasant if it's uncontrolled, just based on the conclusions that we draw, not changing anything external, just purely based on how we change our thinking or our perspectives. I'm sorry, this is jumping around for some reason. Where it's going. Okay. So what we're doing with ACT is to help people to really focus on, become observers of, or experts of their thinking and the language that they're using with themselves, and have better control of that. And as they gain better control, it allows for what's labeled as psychological flexibility. So the ability to make contact with the present moment, what's happening right now, to be able to sort through the difference between the present moment, the past, and the future, right? So to understand that if I'm thinking about the past, then I'm not engaged in the present moment, and I might be bringing that history, those difficulties, those painful things into my present moment. Same thing if I'm really focused on and worried about the future, I'm in that place and I'm bringing that into my present moment, which is making it a lot harder for me to be unstuck and for me to figure out what it is that I need to do in this moment to be healthy and happy, essentially. And how ACT does that is by really helping people to label what is important to them and to make decisions moment by moment through practice to move in the service of what is important to them. And if they can do that, regardless of how things change externally, that can make a big difference in their mental state and what is actually important. I don't know why these slides are skipping the way they are. I apologize because you guys are missing some of this. One of the main things that ACT is geared to look at is something called cognitive fusion. And so that means that as human beings, we structure our worlds based on language. So just like I said before, when we say things to ourselves, I can't do X, Y, and Z, our mind believes that to be the truth. So then we develop a whole series of defenses and avoidance strategies to manage that truth, even though it's not reality. It is the reality that we've constructed because our mind gets fused with the language that we use. So you hear this in patients all the time, these kind of like rules that they live by, like I can't, I never, I have to. And what ACT helps people do is to deconstruct that. So essentially, individuals have more say or more control over their reality. They're able to say, I'm having the thought, I can't do X, Y, and Z, rather than believing the statement, I can't do X, Y, and Z. So this a treatment will allow folks to understand and gain better insight into how those verbal constructions of their life have made up their life. And this is especially true with individuals with chronic pain. I'm sorry, Rana, I don't know why it is skipping around the way it is, so I'm just gonna take it out of animation because you guys are missing the last piece. So people essentially cannot distinguish this verbally based world, right, with all of these I can't rules or I have to rules, from the world as it is experienced through their senses. And ACT is geared to help folks get better control over that and stop what is the main culprit for psychological suffering, which is called experiential avoidance. So in ACT, as well as other third wave therapies like DBT, for instance, experiential avoidance is viewed as the reason why people have what's called psychopathology, right? So mood disorders, all of the different sufferings that we would qualify as psychopathology that lead to dysfunction are a result of this experiential avoidance. So because we don't want to have pain, because we don't want to experience physical or psychological suffering, we will avoid unhelpful or painful thoughts, experiences, emotions, physical sensations. And in the service of that avoidance, we will do a number of wonky, crazy behaviors to not have that stuff. But unfortunately, the more you try to not have it, the more of it you end up having. So it's kind of a catch-22. And there's a mounting body of empirical evidence that really says that this experiential avoidance is at the root of many, if not most, of our sort of what we used to call Axis 1 psychological disorders. And I think that's particularly tantamount for individuals with substance use disorder. What at its heart is a substance use disorder? Well, we know it's a dysfunctional pattern of use, of using a particular substance that has a tolerance and withdrawal associated with it. But why people continue to do those things, why they will continue to pursue that level of intoxication in spite of the number of consequences that it's causing, we can chalk down to the fact that it is very, very difficult to stay present, that by and large, individuals with a substance use disorder or depression or anxiety, what they're trying to do is to not have that stuff. But the more they try to avoid it, the more of it they actually have. So the nice thing about ACT is this is one of the #1 goals of this treatment, is to help people actively embrace what's happening in the present moment, to not avoid, to actually flip that script to the opposite and start to approach the things that they've been avoiding, and to try to do that without some of their defense structures that might not be so helpful. Some of those rules, like those I can't rules, that if they can accept what's happening, it doesn't mean that they're okay with it. It doesn't mean that they're saying, I give my permission for this to be as good as it gets for the rest of my life. But it allows them to deal with what's happening right now, rather than be stuck in this kind of alternate reality, which is blinding themselves to what's happening right now. So the acceptance is actually the alternative to that experiential avoidance. And one of the main tools that we use in ACT to teach this acceptance is labeled as willingness. And willingness is a choice. So it's explaining to folks that in any moment, in any situation, they have the choice to have it or to not have it. And that includes all unpleasant thoughts and feelings. It doesn't mean they're okay with it. It doesn't mean that, that they can master it or get rid of it. They're just willing to have it. And by that choice, now they can do something with it. So it's one of the number one things that has to occur in order to make certain decisions. So we talked about ACT helps people identify what is truly important to them, and we call that value-based action. So all the things that lead to health and happiness in life, we can chalk down to some of these value-based actions. And those aren't goals, right? Those aren't something that's achievement-based. It is the direction in which we walk that is towards health and happiness. So for instance, we use the example of a value might be to go east. Well, how long can you hold that value? How long can you move in the direction of east? Well, you can do it forever, right? You can circle the globe and you can keep going east. So we think about that, any value, like family could be a value. So what am I doing today that is in the service of that value? Well, if I have chronic pain, or I have substance use, or I have depression, I might have some really difficult choices on any given day to stay in alignment with that value. And if I'm really mired in multiple attempts to deny or avoid my pain or psychological difficulties, well, then that's going to make the choice to move in the direction of my family even harder, right? So ACT creates a scaffolding to help people see really clearly what is important to them, and then apply specific strategies to accept what they need to accept in that moment to make that harder choice, whatever that might be, as long as it's in the service of that value. And that's called committed action. And this is the ultimate goal within any ACT protocol, is to promote committed action to move in the direction of what's truly important, or your value set. And any movement towards those values, however small, is going to lead to increased health and vitality and wellness. And that's the progress that's important to emphasize. So it's not achievement of a goal. It's not something that's static way out there in the future. It's the movement that you take moment to moment every single day. As long as it's in the service of that thing, that value set, then it's going to lead toward greater health and psychological well-being. So emphasis is placed on growth instead of specific goal achievement. And the other thing that we explain to folks is, when you move in the direction of committed action, it's going to trigger barriers that shouldn't be avoided. Because again, we want people to approach life instead of avoid life. So by taking some of these steps, it's gonna bring up things that will be unpleasant, but that's not something to be avoided. That's something to be willing to have, because it creates opportunity for growth. So you're always framing everything, every difficulty that occurs. What can you learn from this? What is this teaching you? And is it truly in the service of what's important, or was it in the service of your avoidance? And if it's in the service of your avoidance, yeah, you probably got some short-term relief, but long-term, it was not helpful. The therapeutic posture for an ACT therapist is you have to get, they call it getting in the boat with the patient. You have to have willingness to, and be able to model that. So ACT therapists don't just teach these things, they truly practice them themselves. So one of the things that we're always doing is honoring and modeling that whatever their experience is not bad. It is not the enemy. It is not our job to rescue patients from difficulty or pain. It is our job to help them be willing to have it and to make an informed decision about what they do. And if patients feel trapped, confused, frustrated, angry, anxious, we can celebrate that, because what that means is that they're not avoiding. Right? If they don't feel those things, then they're probably engaging in some kind of what's called a control strategy or an avoidance strategy. And long-term, that's not going to help them. So we celebrate patients being confused or frustrated. And a lot of the ACT techniques are called in vivo techniques, means that we do them in the session, and they're geared to bring up some of those unpleasant feelings so that patients can experience it in the safe environment of the therapeutic relationship and not be so afraid of it, and start to actually gain mastery of it, and then be able to apply it outside of session. So very similarly to how we do exposure work with patients, an ACT therapist has to be pretty comfortable with patients having difficult emotions in the room. And that's one of the goals that we're trying to get to. We're also modeling that willingness, that if we're avoiding it because we don't want to feel it with them, then that's not a good ACT posture. One of the key things that you'll hear when an ACT therapist is working is you're not so much looking at the content of what's being described. You're more focused on its function. So you can break down almost any behavior or almost any thought, rather than in traditional CBT, we would label it as like effective or ineffective, or rational versus irrational. It's not so much labeling it as that, it's more asking, is this behavior, is this thought in the service of what's important to you? And I don't label what's important to you. You label what's important to you. So you can always break down what they're bringing and say, what is this actually in the service of? Because if it's in the service of avoidance, then that's not helpful in the long run. There's tremendous empirical evidence that supports ACT as a viable therapeutic tool for a number of conditions. It is particularly found to be effective for individuals with chronic pain. It helps patients regardless of their condition, regardless of the level of pain that they report, get back to work faster, take fewer sick days, have fewer visits to their MD, and in general, in the long run, report less pain symptoms, even though nothing has changed physiologically. Multiple meta-analyses have been done and shown improvements not just in pain, but also in some of the secondary conditions that come with chronic pain, like depression, anxiety, functionality, quality of life. Because ACT is focused again on helping people make tough choices to move on with their life and live as full a life as they can, regardless of their external situation. So now I would like to shift and talk specifically about ACT for pain. ACT for pain in many ways challenges the conventional notions of pain management. Just like the conventional notions of how we used to treat PTSD, we used to try to medicate, manage the anxiety, help patients to avoid the triggers and the things that were reminding them of the trauma. Well, now we've learned through science that causes more harm than good. That actually keeps people stuck with their condition longer than is necessary. What we do for folks with PTSD is we encourage them to actively approach the objectively safe triggers to gain mastery of it and extinguish that response. So the same thing with chronic pain. Rather than focusing on how you have less pain, we help patients focus on having willingness to accept their pain, willingness to accept that there may not be a pill or a solution or a physical therapy that is going to alleviate it, and they can live with it and live very fully. So rather than focusing on alleviating pain, ACT is really kind of a novel in the sense that it's saying pain in and of itself isn't bad. What's bad with pain is that it stops you from living your life. Well, guess what? You have control over that. So it's not that pain has to be eliminated in order to live your life, that you can live your life even with pain. And in fact, you can live your life fairly fully if you have that perception. Because remember, within the frame theory, we create our reality with the language that we use. So if I believe I can, rather than I believe I can't, well, guess what? That will become your reality. So this is weighed out, I think, with a lot of the science and understanding what causes suffering versus what causes pain. So helping patients with chronic pain understand you may not, or most likely will not eliminate the physiological pain response, right? That you may not get rid of that. But what you can stop is this cycle of trying to control and get rid of pain. And when you do that, then the suffering that's caused from the pain is eliminated. So the pain might not go away, but the suffering can absolutely go away. And the suffering is all of the, I can't, what's the point? It's never going to get any better. The depression, the malaise, the demoralization, the hopelessness, that's the suffering. And those things can absolutely be kicked if you're willing to live your life in the service of what's important to you. So while pain hurts, it's the struggle to get rid of the pain that causes the suffering. So the ACT approach helps patients to really accept that while this thing is unpleasant, their lives don't need to be put on hold to manage it, that they can actually reverse some of the negative patterns that they've adopted, these avoidance patterns, and to approach the pain in a meaningful way, to live with the pain in a meaningful way. And this is weighed out in a lot of the interventions that are recommended, like physical therapy, that what folks have to do is be willing to have the short-term increase in discomfort in order to move the muscles or the bones or the joints in a way that's going to give them long-term relief, right? So ACT is just capitalizing on that same physiological process and saying, look, we can do this psychologically. There are 3 tenets that are used with ACT for, really ACT for any condition, but specific ACT for pain. That's the accepting piece. So that's accepting that it experiences instead of rejecting them because they cause a pain or emotional distress. Choosing behaviors mindfully versus an automatic or conditioned response. So rather than being a zombie that's just kind of walking through life and on autopilot, making truly thoughtful, informed choices about what you're doing on a day-to-day basis. And then taking action that gives you agency in your life rather than being paralyzed or held hostage by the unpleasant thoughts, memories, emotions, or sensations. So we use a metaphor in ACT that's very helpful called passengers on the bus. And this is one where we explain to folks that your mind is like a bus. And you, the quintessential you're the bus driver. You're the only one that can actually drive the bus. Now on the bus, it's filled with all kinds of passengers. Those passengers could be your physical pain sensations, could be that those nagging negative comments about what a loser you are or how you just keep failing. They could be the depression symptoms that show up on any given day. These are all passengers that ride on your bus with you. Now, there's a couple rules about this bus. You can't kick them off. You can't do anything with them. They're there, just like you're there. But you are still in control. And so what people get into the habit of doing is they listen to those passengers. They can't get rid of them. So they listen when the passengers say stop, or they listen when the passengers say turn right, right? When the passengers determine where the bus is going. The unfortunate thing is they're always going to keep you turning in circles, or they're going to keep you stopped because they don't want to go where you want to go. And so ACT is by using accepting, choosing, and taking action, helping folks to really engage with the fact that they have agency, that they're the one that drives the bus. They don't have to listen. And this amazing thing occurs when you ignore the passengers. You accept that they're there. You stop engaging with them. You stop yelling at them. You stop trying to kick them off because you can't, but you just ignore them. Well, they eventually go and sit in the back and shut up. They eventually stop trying because they're not getting their way. And so that's really what the accepting, choosing behaviors, and taking action is geared to help people do. So just like with psychological pain, with physical pain, people have tremendous amounts of avoidance, right? And it makes sense. It's how we're wired. When you touch a hot stove, you automatically pull your hand back because it hurts. So we are wired to avoid pain experiences. And this leads to a whole host of behaviors and emotions around that avoidance. So having tremendous amounts of fear, anxiety around the potential for pain happens with individuals with chronic pain conditions. They stop engaging in activities that they associate with pain, or they abandon things that they used to enjoy because it has that connection. Because remember, humans will make connections when connections don't exist. They will link things that aren't necessarily linked. That's just what our brain automatically does. And unfortunately, these avoidance behaviors, even though they're intended to reduce pain in the short term, wind up causing suffering in the long term because it takes people away from what's important to them. It takes them out of activities and connections and things that give them meaning in the service of that avoidance. And then the avoidance of pain becomes the center subject in their life. It becomes a full-time job and the main thing that they're doing. And we can relate that to our patients that may not have chronic physical pain, but they have chronic emotional pain. And then they add a substance use on top of it. The substance use is in the service of avoiding that psychological pain, but then it becomes a full-time job. In order to maintain that avoidance, it absorbs all of your activity, all of your energy, and pulls you away from the things that are truly important. Ultimately, it results in great dissatisfaction with life and equal to more pain in the long run. So we call that like piling on, right? And we see that with our substance use disorder patients all the time. They've been engaged in this avoidance for so many years. They've selected the avoidance over everything else that by the time they're ready to deal with it, they're looking back at many lost opportunities, tremendous loss in all areas of their life. And so now they have even more pain that what are they going to try to do? They're going to try to avoid with the one strategy that is useful for them in the short term. So in other words, in trying to have less, they end up having more. And this is really interesting. There was a study that was done that looked at what's happening with chronic pain patients in how quickly they can apply willingness to get relief. And one of the studies that they did was they had chronic pain patients go into an fMRI and they looked at the centers of the brain that kind of light up when they're experiencing physical pain. And they would ask the patients, they would say, okay, now I want you to focus on your pain, and I want you to try to get rid of it. I want you to imagine that your pain is a fire and that you're going to do everything you can to put out that fire. To imagine that you're spraying the fire with one of those huge fire hoses, or imagine that you have some kind of ray gun and you can freeze the fire and turn it to ice to eliminate the burning, right? I want you to do this exercise, and we talk them through this exercise. And what happened in the brains of these patients, they would start with their baseline kind of level of activity, stating that they were experiencing pain. And the more they tried to put out that fire, the more they tried to actually get rid of the pain, the brighter those areas grew. So the more pain they experienced, even though nothing was changing physiologically. And then they had them do the opposite. They said, okay, now what I want you to do is focus on your pain. Imagine that it's a fire. It has this burning, strong burning sensation. And rather than trying to get rid of it, I want you to just let it burn. I want you to just focus on the fire being there and be willing to have it. You could even, let it go up, let it die down, let it do whatever it's going to do, but just allow the fire to burn. And what happened for individuals that were doing that exercise is the screen grew dimmer. So the pain experience actually improved just by virtue of allowing the pain to be present. So that's a pretty interesting study that shows us that even with one technique of shifting the mind from avoidance to acceptance, you can have reduced pain experience. That something happens in our mind when we try to have less of it, where we end up having more. And that's true for psychological pain as well as physical pain. So what does ACT do? It aims to increase a patient's activity and function by enabling them to see that they can actually improve and enjoy their lives without doing anything different with their pain level, without doing anything different with their physical mobility. The goal is not to reduce pain, but to help them live their life in spite of pain. And it encourages them to understand that they can live well with or without pain reduction. So positive outcomes of ACT, again, will include an increase in all of their activities, physical, social activity. And what just like with that fire example, when they allow the pain to be there and they stop wasting all of their resources on trying to get rid of it or numb it out, they actually experience less pain. So they report less physical pain, less medical visits, less need for sick days just by virtue of that acceptance. And then that leads to removing all of that piled on suffering, right? It removes the anxiety, the depression, this identity of disability that I can't rules. It removes those. So there are 6 core ACT processes that are part of this. Acceptance, cognitive diffusion, present moment awareness, self as context, values identification, and then committed action. And I'm going to go through each one of these and just give you a brief example of what these techniques would be. Now, to do a full course of ACT would be anywhere from 16 to kind of 25 weeks, depending on the protocol and the individual. So you would work through these 6 core processes and have multiple sessions per each. So you might do several weeks on acceptance with multiple exercises. You might do several weeks on cognitive diffusion with multiple exercises. But I just wanted to give you kind of a taste of what each one of them means. So within acceptance, this is the where you start, right? This is where the model says you need to have some level of willingness before you can proceed, before progress can be made. So you always start with the acceptance quadrant. You want to help patients through various techniques demonstrate willingness to experience the pain they have. So rather than trying to escape whatever is the unpleasantness is, you teach them to learn that it's okay, that it's normal to want to avoid it, but that the avoidance is making it worse. So acceptance techniques are geared to promote engagement in whatever the goal directed action is going to be that you will identify, and have them stop utilizing avoidance or control strategies to manage those unwanted feelings. So one exercise that we do is called, it's called creative hopelessness, is actually geared to build willingness by teaching patients that the emotions that they have, the responses that they have are totally natural, and that their attempts to get rid of it are understandable, but aren't necessarily going to help them. And so you'll make a list on the board of all the things that they've tried. So let's list like medications and physical therapy and acupuncture and hypnotherapy. We'll make an exhaustive list, everything that they have tried to get rid of and not have their pain. And then we'll list out the short-term pros and cons and the long-term pros and cons for each one of those. And then usually once they've gone through that list, we talk a little bit about, okay, what's the pattern? Well, the pattern is that they've tried a lot, typically by the time they come to an ACT therapist. Have any of them been 100% successful in alleviating their pain? The answer is no. And then we say, okay, now what can we gain from understanding the long-term versus the short-term consequences here? Well, what they usually see is they all have some short-term benefit, which makes sense why they would have done it, but the long-term benefit, not so much. So at that point you can introduce, so why not try just accepting what you have right now? What if we just accepted that this pain is here to stay? How would that change what you would do? And help them to get an understanding that, well, they could take all of these things off the table. And what would they do with that time and that energy if they weren't sinking it all into trying to get rid of the pain? And then you can have a really interesting discussion, right, about, that's why it's called creative helplessness. So helping them to accept the pain is going to be there. They're not going to get rid of it. And if they stop using all their energy to try to get rid of it, what could they do now, right? So it kind of opens up a space to think differently. Cognitive diffusion is the next section that you would move into. And that's where we teach people that thoughts are automatic and that we don't realize their impact on our behavior. And in order to diminish the power that they have, we have to first be able to diffuse from it, right? So we do a lot of different techniques to help people get unwrapped or unhooked by their thoughts. And the first step is by just having them notice that these thoughts are occurring without purpose, right? That they're judging things as good, bad, right, wrong all the time without really thinking about it. And that every time that shows up, they get hooked by it, and then that controls their behavior. So you're not so much challenging, like directly challenging their thoughts like you would in CBT, but you're having them to think through how their thoughts are not true reality. So one exercise that we would typically do in cognitive diffusion would be to help people label their thoughts and feelings, begin to create some distance between that. So for example, this is one quick thing. You could have a whole session and then assign homework to have them practice. Whenever they have a thought, I have unbearable pain, just have them label it by adding the phrase, I have the thought, I have unbearable pain. So again, we're not challenging the thought, we're not doing anything different with it, we're just now having them label. And what that does is it puts distance between their automatic emotional response, I have unbearable pain, which is their mind's going to accept as reality, which is going to have a clear emotional connection to it, to saying, no, it's not that I have unbearable pain, it's that I have the thought that I have unbearable pain. So just having them make that one little shift can introduce cognitive flexibility, which will be helpful through all the rest of these phases. The next section we would focus on is teaching what are called mindfulness or present moment awareness. It can be really, really hard to manage suffering when we're stuck either in the future or in the past. So what we have folks practice through various mindfulness exercises is to focus on the present moment and to realize we have about 1,000 thoughts any given second. Why are you listening to some out of others? So we do a number of exercises, but one of the more common ones would be to just have folks connect with their senses and the environment. So doing a lot of work in the session and then for practice to have them take deep breaths, focus on their breathing, and then just start to identify what's right in front of them. Take another breath, relax, and pay attention to the sounds that they hear in their environment. What do you hear? Where does your attention go? And then as they perform this exercise, help them to check in with where their mind takes them and how quickly their mind takes them out of the present moment. That this is a really simple exercise, but it is really, really hard for people to do without some pretty extensive practice. And what they're learning is that they're probably not engaged in the present moment 99% of the time. That any given moment, they're okay. In any given moment, they're actually tolerating their pain. And they're tolerating it quite well, but they're not there in their mind. They're either in the past or they're in the future in their mind. And so the present moment activities are geared to help people gain that awareness. Self as context is, it goes along with becoming more self-aware, understanding your own thoughts, but it's learning to develop what's called the observing self. And you do this a lot in DBT as well. So this is developing a part of the brain that allows you to observe your own mind. So in ACT, we talk a lot about how your thoughts, your feelings, the behaviors that you're engaged in are not you. You are not your pain. You are not your drug use. You are not your depression. You are not your thoughts that it's never going to get any better. Those are like chess pieces on the chessboard. You're the chessboard. You're the foundation that's always present. And the pieces move around and they change from moment to moment. Well, guess what? You actually have control over a lot of those things. So you help them to become aware of that other self. So that allows them to shift their perspective to this observing mind whenever they're really struggling. It helps them to actually learn to view their life without becoming completely mired in the pain. And so we call these pain mind scripts. So it's sort of like the programming that runs on the computer. It's that Windows 10 version, that operating system that's always running. We help them to observe that that's not them. That's not the truth. So that they don't have to listen to or believe those mind scripts that are holding them back. Like, I can't do X, Y, and Z until my pain is better. So an exercise that would fall into that line is just helping them to become better observers, close their eyes, take a deep breath, become aware of what's happening in their body, whether there's pain there or not, whether there's pleasant sensations or not, and what are the thoughts that they're having, and to just practice noticing them without judgment. Values, this is a really, really important one. This is where they're going to start to identify their greatest goals in ACT, which is what are they going to start to do, right? What are their values? And this is where we explain the compass, that values are directions that you can walk in every single day. As long as you take a step, you're going in a direction. Are you going in the direction of avoidance? Are you going in the direction of your value or values, right? So helping them to go through a whole range of domains: exercise, socializing, intimacy, work, family, community, whatever those things are, and define those values, and then rank them so that they have a clear set of guides that they can check in with whenever they're at a choice point. Any decision, any day is a choice point to either go in the direction of their values or go in the direction of their avoidance. So what we would do is just like finding what matters, like going through these things and helping them reflect on, identify what are values versus goals. And then committed action would be the last step. And this is where we put it all together. So this is where the patient actually commits to changing their behavior in the service of their value in spite of their pain. So at this stage, this is where you're really, they've already accepted the acceptance piece. They've identified what they're going to do. The committed action part is where you run into barriers of people sort of falling back on those old behaviors. And this is where it's really important to just support any growth, whether it's a positive or negative experience. If it was in the service of their value, then that's an opportunity to grow and learn and refine and continue to move through that. So usually when you're doing committed action, you're integrating a bunch of different techniques. So you can have people identify very clearly what is the value. So for in this example, the value might be community, a clear concrete goal that's in the service of that value. So this week they're going to go to lunch with a friend, very clearly connected to their value of community. And then you have them list through any barriers that could arise that they need to have a plan for to continue to take that step. So to move them beyond. So it's almost like high risk prevention. So you're having them think through what concrete thing are you going to do in the service of that value, and how are you going to not fall into the pit of avoidance, right? How are you going to not fall into those things? So this is a visual representation of a lot of the work kind of added together, where we're having patients go from, instead of moving away from what's important to them, moving toward it. And the difference between what they're experiencing, their senses, so that's present moment, what's actually happening, versus all of the stuff that's going on inside them, that mental noise or mental activity that could be actually pulling them away from what's important. So you can see that across both of these domains, we could work on relapse preparedness, not just for substances, but relapse to avoidance behaviors, and then what warning signs would crop up across these. So I'm going to give you an example. So here's an example of one that you would do with somebody, where you would have them say, okay, you're in the center, that's your observing self. So you're aware of all of these quadrants all at the same time, especially once you've refined that skill. So you can see that there's a whole set of behaviors that have to do with moving away from what's important to you, a whole set of behaviors that have to do with moving toward what's important to you, a set of mental activity and physical sensation that is pulling you away from what's important, and then a whole set of mental activity and sensation that is in alignment with your values. And so we're always helping people to navigate these quadrants and move towards the upper right quadrant, where they are doing things in the present moment that are engaged with their values and that are pulling them out of that mental noise that is a lot of avoidance and control strategies. So there's a couple different ways to learn ACT. I've given you the link to the Society for Learning ACT, and a number of different books that are available that are manualized that can teach the specific ACT techniques if you're interested. And then here's a number of mindfulness resources that have different things that are specific to individuals with chronic pain needs, and then references for the talk. So I will end here.